Hello, everyone. Welcome to the podcast. My name is Anna Ortiz-Aragon, and this is the Declutter Your Life podcast. And today we are doing episode 43, Chronic Pain. It's Not All in Your Head with Dr. Dave Candy. Hey, Dave, how are you?
I'm great, Anna. Thanks for having me here.
Yes. Oh, my gosh. Okay, so Dave and I originally met at a networking group. It was called NTI, Networking Today International in Webster Groves. And Amanda LaPlante, she's amazing. She's been on a former podcast. She was like the leader. And it was kind of like the healing, holistic, networking group. And so we connected, and then Dave recently had me on his podcast. So we decided to trade episodes, and he has written a book all about chronic pain. And so I wanted to have him on here. So Dave, thank you. And introduce yourself. Tell us about yourself.
Well, I help people with chronic pain. By background, I'm a physical therapist, but what I do these days is very far removed from probably what most people would think of as traditional physical therapy. Not a whole lot of exercise. It's more just learning how to live your life in a better way that's going to help you be able to do the things you want to do, whether that's just staying active, being able to stay independent in your home, or getting rid of some nagging aching pain so you can spend time with family or friends or play with kids or grandkids. And largely when people do exercises, once the pain goes away, they stop doing the exercises and the pain comes back. But if you can teach someone how to get out of bed more comfortably, or vacuum more comfortably, or get up and down from the floor more comfortably, they're not going to stop doing those things because they have to do them every day. And then there's also a lot of lifestyle management with stress management, environment management, which is great on this show, and lifestyle things like sleep, nutrition. A lot of it's more holistic than probably physical therapy. But yeah, that's what I do.
I love it. So amazing. So how did you get into this originally? So first you started with physical therapy. Like, what drew you in that direction?
Well, it's kind of a funny story, actually. I wanted to be, as a high school kid who was as a high school athlete, I wanted to be an athletic trainer. And so I sat down with my high school guidance counselor and said, hey, I'd like to be an athletic trainer. And he said, well, you could do that, but my son's an athletic trainer, and you spend long hours with the team. You work evenings, you work weekends, you work nights. You're kind of at the mercy of the coach, and you don't get paid all that well. I thought, well, that doesn't sound real good. So he said, you should go into physical therapy. And so I did. And I actually did my bachelor's in athletic training and found out that he was actually pretty dead on with his predictions. So went into the doctorate program in physical therapy at the University of Pittsburgh, and came out with my doctorate 3 years later. And then did a lot of education along the way. I got out of school still kind of with that sports mindset that I want to work with athletes, and quickly found that when you work with athletes, it's either whiny high school kids or prima donna kind of professional college athletes who really don't want a whole lot to do with you. And at the end of the day, does it make that big a difference in the grand scheme of things whether the kid can get on the football field or the basketball court this week? Is it really going to affect things that much in the long term? And really, I found that I just got more satisfaction out of helping normal people do things that actually mattered in their life. And at the same time, you come out of school with a doctorate of physical therapy, and you're passionate, and you think you're going to heal the world. And then quickly you find that the stuff you learned in school works for a good percentage of people. And then there's this small subset that it doesn't actually work for. And well, that doesn't seem right. Why do I do this same thing for one person with a back problem and they get better, and this other thing for another person with a back problem and they don't get better? And so I wanted to find that out. And so went into doing a fellowship in manual therapy, which teaches you a lot about how to work with your hands and do like soft tissue manipulation, spinal manipulation, hands-on things. But really the true value in that was the reasoning, the clinical reasoning, to be able to think through difficult problems and be able to find out, okay, why is this problem different from another problem that may look similar? And how could I treat this different in order to get a better outcome? And along with that, I learned a lot about chronic pain. I also did some more training with a dry needling institute that teaches you a lot about chronic muscle pain. And I had a few great mentors at one of my former jobs that just opened my eyes to this whole new world of chronic pain, that it's not just in your tissues, that normally your body can heal itself within about 12 weeks from most injuries or most type of problems. But yet there are people, and we all probably know one, that has pain that lasts for months or years or even decades beyond that. And so learning the other factors that affect pain, it's much more of a whole person approach, and not, hey, my knee is injured or my back is injured or my ankle is injured. And so that's kind of how I got more into the holistic approach.
I love it. So interesting. Yes. So I used to be a personal trainer. So I became a certified personal trainer. And I love what you're saying about functional movements, because a lot of personal trainers, it's like Shaun T, insanity, or like burpees all day long. And that can actually cause a lot of stress on the body. And so like I remember meeting some trainers that were like, okay, there's 4 essential movements, like push, pull, press, and squat. And like that's so you can like pick something up off the floor, so you can get out of bed, get in and out of a chair. And I think that helping people with functional movements is crucial. Yes.
Yeah, that's the bulk of it from the physical standpoint, and then the whole other lifestyle factor is another animal in itself.
Yes, absolutely. Oh my gosh. So you mentioned that the body can heal itself, and I'm like 100% a believer in that. So how did you become, how did you experience this yourself? Did you like heal yourself from some kind of injury? And so you were like, hey, I know that it's a holistic experience and that we have to treat the whole person.
I've been very, very fortunate that I've not had a ton of major injuries myself. A knee injury my senior year of high school, but largely that got better in the time frame that it should have. And I never actually myself had to have physical therapy, but going through sports in school, and my mom had some physical therapy, and I saw the effects of it early on. I thought, there's some value to this, but kind of lost train of thought there. What was your original question?
Oh, yes. It was that the body can heal itself, and just how powerful that statement is.
Right. So when the body heals itself, there were millennia where humans existed, and there were no medications like we have today. There were no MRIs. There were no surgeries, at least not the way that we have it today. It was pretty brute. And yet, humans survived. They found a way to make it happen, and really, that's evolution at its basic. That survival is going to survival of the fittest, and we like to think as humans that we're kind of immune from that, but we're not in some respects. But no, I never really had a personal experience with it. I had experiences, I guess, as a practitioner of people that didn't get better with the traditional approach. And I thought, well, there's got to be something else out there. This is what I stumbled across.
I love it. Yes. So tell us a little bit more about the other factors that can contribute to pain. So you said, it's not just your knee all the time. It's not always your ankle. There can be other factors affecting the pain.
Well, sure. Pain is something that we call a biopsychosocial phenomenon. So it's biological, meaning your tissues and your body, the stuff we typically think of, but there's 2 other pillars to that. The psychological, what we think and feel about it, does it make us anxious? Are we depressed because we can't do the things we used to do? Are we fearful that we'll have to live with the pain for the rest of our lives? And actually, research has shown that those factors are much, much higher predictors of chronic pain than are any like MRI or physical finding. And then the last component is the social component. the things it stops you from doing in society. So does it stop you from holding a job? Does it stop you from taking care of your household? Does it stop you from being a mom or a dad or a grandparent? And largely most people can deal with some pain. You ask most people and they'll say, yeah, I have a pretty high pain tolerance. But when it stops you from doing something that you either need to do or that you really love to do, that's when it becomes a problem. Mm-hmm. And so every pain experience has a little bit of bio and a little bit of psycho and a little bit of social in it. Every single one. Now, in some like acute injuries, when you just hurt yourself, it's very, very, very highly bio and a little bit of psycho and a little bit of social. With chronic pain, that bio starts dropping out. It's not gone. Abnormal movements can still kind of trigger things. Your body still plays a role, but the psychological and the social, the longer it's been around, the more you start to worry, hey, is this ever going to go away? The more you start to get depressed because, hey, I used to be able to do X, Y, or Z, and I'm not here anymore. The more you start to get anxious that, hey, I'd love to go do this, but I'm worried that if I go out, I'm going to have to stop because it's going to hurt. And I don't want to drag my family and friends down or be a burden to them. So I'm just going to stay home and suffer in my misery and not bring anyone else down with me. And that's really kind of a sad way to live. So I try to help people break out of that and be able to get back to doing the things that they love.
Yeah. Oh my gosh, I love that. The psychological for sure and social, like the placebo effect, like that's a real thing. So if you believe you're going to get better, you will. And if you don't, like you won't. And the social aspect as well. And I think it's definitely interesting. So, oh my gosh. Okay. So during 2020, do you feel like your patients have experienced more pain, particularly because the social aspect is so like constricted right now?
Yeah, I do. And especially, here in St. Louis, we were under a 2-month basically stay-at-home order where unless there were necessities like going out for grocery stores or going to doctor's visits, you're pretty much at home. Yeah. And spending a lot more time in your environment. I'm sure you saw a lot of issues with people being at home more, but also they were moving less. Exactly. It's amazing how much just going out to the grocery store or going out to a shopping mall, which people weren't doing, going and spending time with family and friends or doing things together outdoors in public facilities, walking up the stairs at a hockey game or a baseball game. You get exercise and activity even when you're not exercising per se. You're moving around, and when you stop moving, you start hurting. Things get stiff and tight. And at the same time, people were depressed. They couldn't do those things. We still really don't know how long this is going to go on. We understand more about the virus, but at first it was just kind of new and scary. And there was a lot of fear out there. There still is. And just the uncertainty of it.
Yeah, absolutely. I can only imagine. Just like you said, you don't really have to go to CrossFit every day or run a mile every morning necessarily. You just have to have some kind of movement in your day. Like I always think back to our ancestors who were living in villages and stuff, and they were just farming, they were just living life, and they were, basically they didn't need to exercise. They didn't need treadmills or gym memberships. So interesting. And yeah, depression and anxiety can definitely be like physically painful. Yes. So tell us a little bit more about, like, I'm really interested in the psychological aspect, the think and feel. Any other tidbits that you have for us, especially from your book, Chronic Pain, It's Not All in Your Head?
Yeah, well, thank you for that. It's called Chronic Pain. You're not just getting older, you're not crazy, and it's not all in your head. But, the psychological aspect, like you mentioned, I think you mentioned the placebo effect. And they talk about that in pharmaceutical trials or in medical research. You have, an active group and then a placebo group, which people kind of say like, well, the placebo is just, it doesn't actually work. You're just thinking about it. But hey, if taking a sugar pill makes me feel better, I'm going to take one for the rest of my life every single day, as long as there's no side effects to it. That, just because it's not the effect that you're studying for that particular drug or medication or surgery or other intervention that you're doing, doesn't mean that it's not an effect. And there's also the opposite of that, like you mentioned, is called the nocebo or nocebo effect. That if you don't think something's going to be effective, even a highly, highly researched effective treatment, if you don't believe in it, it's probably not going to work for you. And so, kind of finding the right solution for each individual person is really important, because a drug or a physical therapy treatment or some sort of protocol is exactly that. It's a protocol. It works for most people a certain percentage of the time. But if it's 99% effective and you're that 1% it doesn't work for, it does you zero good. It doesn't help at all. So finding the treatments that are most likely to help an individual and then monitoring those effects, and not getting married to one approach. That, hey, we try this. This is very likely to approach based on everything that I know and all the patients that I've seen in the past, and we'll see what effects you get from it. And
okay, guys, it looks like Dr. Dave is buffering. So yeah, we'll just hang out and wait for him a little bit. But yes, we were just talking about the 3 different pillars of pain. So Dr. Dave was telling us about the bio aspect, which is the actual pain experience, the feeling in your body. And then he was talking about the psychological aspect of pain, which is how you think and feel about it, right? Which can include depression, anxiety, maybe embarrassment, those types of things. And the social aspect of pain.
I think I'm back here, hopefully.
Yes. Okay, we have no video, but we can hear you. Yes.
Let's see. There we go.
There
Sorry,
you go.
I realize I'm on my laptop and I realized that I did not have it plugged in, so it dropped out there for a minute. But
all good.
Yeah, so we were talking about placebo and nocebo, I think. Yeah. And based on past history and everything that I've seen in the past, we start with one approach, but keep an open mind that, hey, if this isn't the approach that's working for you, you need to do something else. And I encourage people who have had lots of different treatments, which most of my patients by this time, they've been to chiropractors, they've been to physical therapists, they've been to massage therapists, they've tried pills, injections. Some have even had surgeries and still have pain. And they're searching and searching and searching. And after a number of failed attempts, people start to think, I've tried everything. There's nothing else. I'm just going to have to live with this. And there's something out there that's going to help you. You just haven't found it yet. And just not giving up that hope is probably the biggest message that I would have to people, is that have hope that it'll get better, because there's a way. And a lot of times the things that I find to be most effective, they're simple. Almost so simple that, like, with this big problem, people overlook the small stuff. And just making little changes, like eating better, sleeping better, stopping smoking, moving more, managing your stress a little bit better, decluttering your environment if that's stressing you out. Just little actionable things are really what I find makes the biggest difference.
Absolutely. Yes. And yeah, that kind of brings me to my next question. So I was thinking about the title of your book, and how do you honor the patients that have been looking around, they've maybe been turned away, ignored, sent to a bunch of different specialists? Like, how do you honor them and really see them in the pain state that they are experiencing?
Well, I mean, it starts with just taking the time to listen to them. And that's something that we as medical providers are not good at a whole of doing. That always having to worry about next patient in a typical medical environment. I think there's a study that says it's about 7 seconds or 10 seconds or 11 seconds, somewhere. It's not long before we start to interrupt people as a whole. And just respecting someone enough to say, you know what, I'm going to keep my mouth shut no matter how much I want to chime in, and just let you tell your whole story. Because a lot of people who have been suffering for a long time, there's a lot of history. And that's, if you listen to the patient long enough, they're pretty much going to tell you what you need to do. But the problem is we just can't keep our mouth shut long enough to actually let them get to that answer. I think there's a humbleness on our part about, you know, not just jumping to, hey, this is what I do and I'm the expert and I can help you, but saying, okay, I'm going to listen to everything you have to say, find out where you're coming from with things, and then we'll move on terms that you're comfortable with. And I always give people the option that, hey, this is what I think would work best based on everything that I've seen in the past, but here's another option for you too. And you know, if you would prefer that one, I'm perfectly fine to go on and do that other one, because at the end of the day, it's your life and it's your body, and you're the one that has to make the choices and live with the outcomes of it.
Yeah, I think that's so powerful. Like listening for sure. That's definitely how I approach my organizing clients. Like they just, just let them talk, let them tell you the stresses, and they will often point you in the direction of the answer. And then I also liked how you touched upon choice, and that you can empower the patient. Like oftentimes, I am, like 9 months pregnant, for example, and I don't feel like I have a lot of choice in my prenatal care. And sometimes that can be really frustrating and like insulting a little bit. Like I don't have a say. So empowering your clients, saying, hey, this is what I would recommend, but here's another option, so they can feel a part of the process and a part of the healing. And I think it also like makes it that they will be more willing to stick to the treatment because they had a say in it. Like they were a part of the solution themselves.
True. Yeah. And I don't know if you watch the show Hoarders at all, but they always, the people that change their mindset end up doing really well. The people that they say, hey, you just need to throw all this stuff out fast. Yeah. They throw all the stuff out and then they reaccumulate it. So exactly. In order for anything to be effective, whether it's getting your house cleaner or whether it's making your life better or getting out of pain, in order for something to change, you have to change.
Yeah, you have to buy in. You have to be an equal participant in the matter. Oh, so good, Dave. Okay, so now I'd like to slide on to the next question. So this is something that I ask everybody on every single episode. What is something that you have recently let go of?
Oh, let's see. Honestly, control is a big thing. I am by nature a perfectionist and a control freak, and I would love to just be able to control every aspect of my environment at all times. But number one, that's not feasible. It's not possible. And two, it becomes so stressful, being a perfectionist, feeling like you have all these balls up in the air, and if you drop one, the world's just going to come crashing down. And I'm not that important. You're not that important. The world does not depend on, whether you want to wear the green shirt today or the blue shirt, and those are the things that I found myself stressing out over the most, is that when I have to make a big decision, I'm actually pretty good at doing it and making a good decision quickly. But when it comes to like the little tiny things that don't matter at all, I just go back and forth and back and forth and back and forth. And letting some of that go has been a big thing, with some of the unpredictability of the environment these days, just saying, you know what, I'm going to do the things that I can do that are under my control. And I'm not going to worry about all the things that I can't change, because I can't do anything about it. So there's no sense stressing over it. And as my business has grown and I'm gathering some new employees in the business, I would love to just be able to do everything myself, but I don't have that much time. And being able to trust things to other people and say, you know what, I'm just going to kind of let you manage this. And if you make a mistake, oh, well, we'll go over it. And a lot of times when I do that, I find out they do it better than I do in the first place. So, I try to stick to the things that I'm an expert in and delegate the things that, I probably don't need to be doing myself. And a lot of times I find that their complementary gifts and skills, are much better at the things that I'm not good at.
I love that. Yes. Yeah. Control and perfectionism are definitely a theme in my life as well. Definitely. And I often say, like, perfectionism is a train that you're never going to catch. So
True.
like, do yourself a favor and just delegate. Yeah, delegating, especially as business owners. It's like, this is our baby. We worked so hard. Like, we love the brand, we love our clients, but yeah, letting others help us and support us is really how we're gonna like affect greater change and influence in the world. So that speaks to me deeply. Yes. I love it. Okay, so Dr. Dave, will you please tell us, how can we reach you?
Sure. So I have a lot of different channels on social media. We're on Facebook at, our handle is m4lpt.com. On Instagram, I think, and Twitter, I think it's actually movement, the number 4, lifept.com. And then our website is the number 4 lpt.com. So you can find us at any of those. I also have a podcast, the St. Louis Pain Expert Podcast, and a book that's available on Amazon. It's called Chronic Pain. You're not just getting older, you're not crazy, and it's not all in your head. And it just answers some of the common questions about pain that I've found myself repeating over and over and over and over and over. And so, if you have some questions, it's a great resource. Yeah, that's pretty much how you can get a hold of me.
I love it. And I love the title of your book. I think it's so interesting. Like, all those examples, like, oh, just, it's great. I am attracted to books with like super interesting titles. So I love the way you did that.
Well, those are the things that I hear people say all the time, is that, oh, my doctor said I'm just getting older and I have to deal with it. Or, they're telling me that nothing's wrong, that my MRI looks normal and I'm going crazy, or it's not all in my head, but something's wrong. And they're right. If you're hurting, there's a reason for it. And it may not be always a physical reason, but at the same time, it's not all in your head. You're not crazy. You're not making it up. It just may not be a problem on your MRI or in your knee joint.
Yes, absolutely. Oh my gosh, amazing. So thank you so much for joining me, Dr. Dave. Do you have any final thoughts you'd like to share with us before we sign off?
Yeah, I think and I kind of shared this before, is just that don't give up hope. If you're suffering from pain, whether that's a physical pain or an emotional pain or some kind of stress, that there is some help for you somewhere out there. And just don't stop looking until you find that. And there are a lot of resources out there and a lot of people to help point you in the right direction.
Wonderful. Yes, thank you. This was really great. I'm so excited. And yes, you guys, I'm going to be uploading this video to YouTube. I'm going to be sharing it everywhere. I'm going to put it on Instagram. And please leave some comments here. Dr. Dave, tag him, tag his business, and he will respond to you. Check out his book, check out all the links in the show notes. And I hope that you guys learned something and really resonated with this episode today. Thank you so much. We're going to sign off. Thank you, Dr. Dave.
You're welcome. Thanks for having me, Anna.
You're welcome.